is Chris Williams, and this is going to be the Week 8 checkoff for Health Assessment 2. We're going to go ahead and get started. So first thing you would do is you would knock on the door, announce your entry, and you would walk in, you would perform hand hygiene. So that's things over here. Or you can use sanitizer, depending on what you got in the room. Like we have a lab, we have sanitizer. Okay, and then you would introduce yourself to your patient. Hi, my name is Carissa Williams. I'm going to be your student nurse today. Do you have any allergies?
No.
Okay. Before we get started, and I'm going to check your wristband. Can you give me your name and your birthday?
Diane Williams, February 23rd, 1966.
All right, thank you so much. So we double checked her wristband. That's doing identifiers for her. Make sure it's the right patient, right person. I can tell that she is dressed appropriately for the weather. Her response to me was accurate and appropriate. Now we're going to check her A&O times 4. Can you tell me where you are?
Highland, Illinois.
Okay. Can you tell me why you're here today?
For a general health assessment.
Okay. Can you tell me who you were here to see?
Carissa Williams.
Okay. Can you tell me the month and the year?
Oh, well, I was going to say February. It's April 2020.
Okay, I was going to say March, so I'm one of us now. All right, so it's April 2020. She has A&O times 4, which means she knows person, place, time, and situation. Maybe a little bit of time. I don't know what to do. Okay, and so with that, I can also tell that she isn't in any sort of respiratory distress, no use of accessory muscles or anything. She's not, doesn't have any diaphoresis, she's not sweating, she doesn't look flushed, she doesn't look panicky or, restless. She's no need for concern there. She's got good hygiene. I can tell her dress is appropriate for quarantine in her house, including the little sandal slip-ons you can't see down there. Her face is appropriate, and her mood is appropriate for the situation. She seems fine and coherent. So with that, we're good to go. Next we would check her vital signs. We're not going to do it for this video, but her vital signs, they're within normal range. We're just going to go with that. And like I said before, she's not in any distress. We're going to move on to skin and nails. So first we're going to check your... Okay. First we're going to check her nails for capillary refill. It should be less than 2 seconds. It should be returning. Okay, I'm going to check for clubbing. Okay. All your fingers look good. I'm going to check her overall skin. She's got a few netties and a few macules. Nothing looks concerning. There's no lesions, there's no bumps, there's no bruises. Skin on her face is even. It's appropriate color for her ethnicity. On her legs, I don't see anything either. No any weird bumps, bruises. I could even, check her feet and see if there was any, any ulcerations going on in her feet. But she's clear. No bumps, bruises, scrapes, lesions of any sort. Okay. So next we're going to move on to her head. I'm going to check your hair. I'm looking for any bumps, bruises, lacerations, infestations. I'm going to feel your scalp, make sure it's all in the nice shape that it should be. Okay, there's nothing there, everything is all normal. Okay, we're going to check your cranial nerves. Number 5 is your trigeminal nerve. Can you clench your teeth for me? Okay, that's good. And we're going to test your sensory of your cranial nerve. You're going to close your eyes, and I'm going to touch this in your face, and when I do touch it, if you feel it, will you say now?
No, 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 no.
You generally do it across their T-zone, so forehead through their nose and across their cheeks. So cranial nerve 5 is intact for her. Now we're going to do cranial nerve 7. Can you smile? Can you raise your eyebrows? Can you frown? This is her facial nerve, and it controls all those muscles in her face. Next, we're going to do number 11. I want you to, can you turn your head to the right? Can you turn your head to the left? Can you bend it both side to side? Can you go back and forth? Okay. And then can you shrug your shoulders? And then can you do that against my hands? Okay, there you go. Cranial nerve 11 is intact. Okay. Now we're gonna work on do your eyes. First, I'm gonna check your sclera and conjunctiva. They are clear the way they should be. Your conjunctiva is pink and it's not redness. I don't see any discharge that's not there. Your pupils are equal. They are round. They are reactive, consensually to light. Means they're constricting when I put the light over it, and they're doing it together. And then we're going to check your accommodation. So can you please stare at this? And it's going to go towards your face and keep looking at it. There you go. So that's all good. Now we're going to check your cranial nerves 3, 4, and 6. We're going to do 6 different points. I'm going to move my pen and I want you to keep staring at it, okay? Okay, good. Good. Job. Last one. Okay. And so that's our 6 Kernos fields of gaze. Let's check all those nerves. And her extra eye movements are all good. Okay, next we're going to check her ears. I can see that she has an ear piercing on both sides. I'm going to check for any redness or discharge. Use my pen light. I don't see any redness or discharge, or doesn't look like anything swollen on her ear. And that her ears are done. Okay. Oh, well, no. We gotta do her whisper test to check her hearing first. And this is cranial nerve 8. So I'm going to whisper something in her ear, and she's gonna repeat it out loud. Okay?
Well, to be honest, I didn't hear that.
Okay.
That's a sign.
Side note, my mom is deaf in her left ear, and that's just what I did that to. So normally she'd hear that, but she can't hear some of those ranges, so I said blue car. But anyways,
Okay.
We'll do the other side.
I thought you were being funny and said Corona. Red hat.
Okay, see,
I heard that one.
she can hear on her right ear. She just can't hear on her left. Anyways, if a patient had bilateral hearing, that was correct. They would hear both those and they repeat it out loud. My mom can't. Oops. Okay, so now we're going to check your nose. I'm going to check that it's even, it's symmetrical. I'm going to make sure that there is no septum deviation. I don't see any polyps or anything. Have you had any drainage from your nose recently, anything like that? Okay, I don't see any. Everything looks clear in the way that it should. We're going to check your patency though. Can you put one finger over your nostril? Breathe in. And can you do the other side? Okay. She has a bilateral patency in her nose. Okay, now we're going to do, I'm going to look at her mouth and her gums and all that. Your lips are pink, they are moist, I don't see any cracking, no sores around it. Your teeth are good, they're in good condition. Your inside of your mouth is pink and it's moist the way it should be. Your tongue is pink and moist. And your gums are all the correct color. I don't see any bleeding or any ulcerations inside your mouth. We're going to check your gag reflex. Normally use like a tongue reflexor, but we're going to use the end of a plastic fork. So you stick your tongue out, say ah, okay, and then we're going to have her move her tongue. Can you stick your tongue out and move around? Okay, so your cranial nerves 9 and 10 work, and now we're going to check cranial nerves 12. Can you say light, tight, dynamite?
Light, tight, dynamite.
Here we go. She can pronounce those. So all of her cranial nerves work for that area. Now we're going to move on to breath sounds. Ooh, pulling flinch out. Okay. Like I said before, I don't see any accessory muscle use while she's breathing, so that's good. She should be breathing from her chest and not from like her rib cage. So I'm going to listen to her lung sounds on both her front and her back. I'm going to place the stethoscope on your chest, and then I'm going to do it on your back. Every time I move it, I want you to take a deep breath in and a deep breath out. Okay? That's our right middle lobe. This up here was the right upper lobe. This right here was the left upper lobe. Now we're moving to the rest of the left lower lobe. This is the right lower lobe. This is the left lower lobe. Okay, now we're gonna move under our back.
I can turn around, you can stay. That's okay. It's in the.
We're gonna do left upper lobe. Right upper lobe. Was the left upper lobe I just did, or right, left lower lobe, sorry, and the right lower lobe. I'm gonna do right lower lobe again. And left lower lobe again. Okay, so I don't hear any adventitious sounds, and everything sounds normal. Ignore the dog in the video. Come. That's Schaefer. Okay, so I don't hear any abnormal crackles, wheezes, anything like that in her lungs. It all sounds normal. So now we're going to stop this video and move another one because they won't upload.